Okay, guys, first thing I have to say, for those of you guys that wanted to know, I didn't lose the 15 pounds before the wedding, but they got vest on me. I didn't look fat at all, so it came off pretty good. All right, guys, what are we talking about today? Oh, I have to tell you a funny story. I got a bunch of funny stories today. What is this? Good job, guys. Frontal lobe, temporal lobe, parietal lobe, and we'll put here C for cerebellum. And they classify the brain as midbrain, forebrain, hindbrain. So we're talking about right in here. I'm going to make this dark. Why am I making it dark? We're going to talk about the substantia nigra today. It's pretty interesting. Nigra. I like to look up the history when I do different talks. And what was interesting about this is I've been doing this 33 years, and I didn't see a problem with restless leg syndrome till like the late 90s. And what we're going to talk about is what it is, where it comes from, and how you can improve yourself if you have it. Okay, so in order to understand this, you have to understand the brain chemistry. Anybody ever heard of the substantia nigra? I'm not putting anybody on the spot, but I just throw it out there so everybody needs to understand what it is. The substantia nigra is the part of the brain that develops dopamine. It synthesizes dopamine. Dopamine is responsible for all muscle movement in the body. So disease called Parkinson's, you don't have enough dopamine. Everybody follow me? Yeah. What's interesting is when you see the history, in 1923, a scientist out of Sweden figured out with animals, let's go on the side here 1 second. As I was going through this research, Dr. Oz was involved in some of this research. Back over here. I'm glad they didn't stick needles in me to find out about dopamine. My father was a physical therapist that did nerve conduction studies. And one time he had me come to the office and he said, hey, I got to practice this test. And all of a sudden I felt this pinch and it hurt like heck. And I'm like, what the hell are you doing? And I looked and the needle was this long. But he had to practice on me to learn how to do the EMGs. So once again, what has to happen is for research, and this was 1923, they had to figure out what part of the brain did what. So they're not going to use humans because they weren't allowed back then. So they used animals. And unfortunately, dogs, rats, cats. I did research in Texas back in the 80s on a birth control pill, and we used cows and sheep. And the bottom line is that that's how you do the research, is you find out from the animals how these chemicals work. Why I brought that up was this guy found out that dopamine is the main chemical for movement. Okay? So what is restless leg syndrome? Let me tell you as a doctor the kind of stuff I've heard. Doc, I get this feeling in my leg. It's like the fizz you get when you pour a glass of Coca-Cola on ice, and that fizzing sensation is kind of in there, and it won't go away, and it's usually when I'm laying down. And I've had a sensation like that when I hit my funny bone, but it only lasts for seconds. Or they'll tell me that they'll get a sensation that no matter how hard they try, they have to move their leg. They can't stop that movement, that it's just overwhelming, that they're sitting there or lying there or somehow in a position where it just wants to move. And despite in their mind how hard they try, it's like a cough. You know how when you get a cough this time of the year and your throat's dry and you're talking to somebody and you don't want to cough, or you're close quarters and you don't want to cough in front of somebody's face, then you hold your breath or you do whatever you do to try not to cough, but you still cough. And that's what happens with the restless leg syndrome. It's an uncontrolled movement, and usually it's of the legs. That's why they call it restless leg syndrome, but it can also happen in other areas. So what we're going to do today is run through how all the information came to be and what it really is and the things you have to pay attention to if you want to get rid of it. Okay, so everybody understands dopamine, 1923, studies on dogs found that if you inhibited dopamine in the brain, you can't move. Putting dopamine back in, you move fine. So they found it was a movement chemical. What does that mean? Terminology: neurotransmitter. I'm spelling wrong. Sorry about that, guys. All right, what's a neurotransmitter? Just like you said, remember I always said if medicine was hard, I wouldn't be a doctor. Okay? Neuro stands for nerve. Transmitter means it's going to send a signal. So, in the brain, I'll put NT. We have neurotransmitters. Dopamine is one. GABA-butyric acid is one. Acetylcholine. I'm going to spell these wrong. Acetylcholine, norepinephrine, epinephrine, and there's more. But these are the important ones, because what we're going to talk about is dopamine is also important in your mood, your memory, your ability to think, your ability to reward yourself for a goal that you're setting out for. So it's a chemical that's required in the brain for many functions in the brain. And again, where's it located? Right in the middle. It's called midbrain. All right, so now what do we know? We know that dopamine has to do with movements. We also, it has to do with mood. And we also put here reward. And if you think about it, remember our talk from last month? Getting 3,000 ads in front of you, 10,000 ads if you're a child. That's where this all comes from, guys. This is knowledge that's out there of how the brain works, how it functions, what things happen, how you see images, how you can go in your mind's eye. Right now, you can all pull up your 16th birthday, or you can all pull up the day you first drove a car. You know, that's the power of the brain and the ability of the brain. And so what happens is these chemicals become vital. So what occurs in restless leg syndrome? What do we know? First and foremost, what's a syndrome? I spelled that wrong too. Sorry guys, I'm having a tough day. Syndrome. What a syndrome is a constellation of signs, symptoms, findings, but you can't connect the dots. So it's not a disease. What's a disease? You can connect the dots. What does that mean? Diabetes. What do we know about diabetes? We know there's a genetic abnormality, type 1, and type 2. The insulin becomes resistant in your body, and we know your sugar is going to go up, and we know how to treat it. Disease. We connected all the dots. This is a syndrome because we don't have all the dots connected. What do we know? You can't control that movement. When it comes upon you, you cannot control it. What do you feel in your body during that time period? I told you, some people tell me it's like the fizzing of Coca-Cola. Other people tell me it's like a little thrill running through their leg or electrical discharge. But it's something, it's Alka-Seltzer, good one, but it's something that you can't control. This is something that comes on you. So who wants that? Nobody. So again, what's out there? Knowing what I just told you, neurotransmitters in the brain at the substantia nigra is where the dopamine comes from, and movement, mood, and reward is what we're going to focus on today. All right, now pay attention to, we'll put the brain over here so that we remember those neurotransmitters. And now we're going to go to John. And John is a 55-year-old truck driver. He runs California to Pittsburgh 3 times a week. And he sleeps on the side of the road. And he did well. He's in his 30th year of doing this. He did well, as he says, when he was a kid. But then once he hit 45, that was the year that he decided that he wasn't a kid anymore. He said he noticed the difference. Along with that, he gained probably 40 pounds in that period of time. And what we ended up with was, on the side of the road trying to sleep, he couldn't sleep. So then he's taking stuff to stay awake. And then he got into a situation where he felt it was dangerous, and indeed it was. And so what we did was we looked into what's the knowledge and information out there about restless leg syndrome, and how do you effectively treat it for someone like him that earns his living on the road, and you can't go without sleep. Because that's the biggest problem with restless leg syndrome, is when you lay down at night and you think you're ready to get some shut-eye, even if you've been up for 20 hours, you can't. Because you can't control the movement of that leg. When it hits you, you cannot stop it. It's like the cough that you can't stop. It won't stop. So again, what do we know? The data that I told you, 1923, showed the dopamine, and all the scientists agree that the number one problem is the dopamine, and I'll put an R. What's that stand for? The receptor. What's a receptor? Receptor is a place where one signal gets to another signal. We've done this before. Everybody do it again with me. Let's look at the G. As you're looking at that with your right finger, bring it in front of your right eye. And as it comes in front and all of a sudden you're focusing on your finger, that's called accommodation of the eye, and it takes 350 milliseconds. Does everybody understand that? And what did it have to do? It went from the Edinger-Westphal nucleus in the back of your head through the midbrain to your eye as your finger was there. And it did all that in 350 milliseconds. How does it do it? That's what the neurotransmitter is all about, and that's what the receptor and the chemistry is all about. And how does it happen? The medium of the brain is all water. 90% of the brain medium is water. So in this water environment, electrical signals are sent, chemical signals are sent, and is at the speed of 350 milliseconds or faster. So what occurs? The receptor that's supposed to receive that information, everybody wiggle their right toe, right foot, big toe. That's the longest nerve in your body, from the top of your head down to your foot. And 3 different receptor signals took place for you to wiggle your toe, and you wiggled it how fast? 200 milliseconds. So you see the speed at which everything works. So what happens? The receptors don't receive the signal to produce the dopamine. Why? Theories. I'll put a big T for theories. Big one is iron deficiency. Another one, vitamin D3. Do I have any of my patients taking iron and vitamin D3 to try to bolster their dopamine? No. Will I change for that? I may, depending upon what I see in some of the studies that are out there. What we're finding is very unique. Has anybody ever heard of the blood-brain barrier? Let's do it. We'll still do it this way. The blood vessel coming up in your neck is the carotid artery. So we'll put carotid artery. So the blood makes its way to the brain through what's called the circle of Willis. Okay? So all the blood is flowing, the blood's getting to the brain, and what the theory is that the area right at the base of the skull is what we call the barrier. And what does that mean? That means that unless you have someone invite you, and that's the receptor, you can't get certain chemicals into your brain. Does everybody follow that? So the blood-brain barrier, BBB, stops this from occurring. So if you take iron, it's not going to get to the brain. Everybody follow me? If you take vitamin D3, it's not going to get to the brain. You have to bind it with something that takes it to the brain. So that's number one to think about, and we'll talk about treatment in a minute. But what we do know is if you get this dopamine to the brain, restless leg syndrome goes away. So what do you have to think about? What's causing the problem with the receptor? What did we find out about diabetes? We found out about diabetes through all the research that was done that the insulin becomes resistant, meaning your body makes insulin, but it's now resistant to work in the natural chemical way the body normally works. Everybody understand that? So what it means is it's inferring that something is having an effect on the dopamine receptors. And again, where were they? Midbrain, called substantia nigra. So, what were the first treatments? Medicines that will allow the dopamine to get past this barrier. And these are what are called dopamine agonists. And there's a ton of them on the market. And chances are, if you've had the symptoms, you've taken them. But what happens is, it's just a temporary fix. If you don't fix the problem with those receptors, your body's trying to make more dopamine, and eventually it can stop being able to make more dopamine. So you have to get to the issue. What's the issue? The issue again becomes blood-brain barrier. So now technology is allowing us to get the iron back to the brain and the vitamin D3 back to the brain. What does it all come from? They gypped me on paper today. I'm going to pick on them. What does it all come from? We've talked about this before, guys. Inflammation. Has anybody ever put a candle out with your fingers? Okay. Well, the reason I bring it up is it's not really hot at all if you do it fast. If you hit it fast and stop, you don't feel anything on your fingers whatsoever. But when I've said that to different people, including my boys, and they tried to do it, if you get a piece of wax on there, you can burn yourself. And so my wife would say, did you really do something that stupid telling them to try to put that candle out with their fingers? And I said, it's a testosterone thing. I get to tell you my story about that later. So anyhow, my whole point to all this is that inflammation comes from many things, one of which is heat. Remember that. Smokers. Greater than 200 degrees, you're breathing in. Chewers. Anything you put in your lips gets absorbed, and that tissue gets inflamed. Think about a cut or a bruise, and think about the phases that occur. It bleeds. After it bleeds and you stop it from bleeding, you get what we call a scab or scar tissue, okay? Imagine that tissue inside your body, because that's exactly the same thing that happens. You follow me? Your skin is nice and soft and smooth and no problems, and all of a sudden somebody scratches you so deep that it bleeds. And after it bleeds, you'll get a little form, we call that granulation tissue, where there'll be a little mound of maybe red, yellow, different types of colors that we call the scab. And then that scab kind of shrinks a little bit, dries up, And when it falls off, the skin looks good again. That capability happens internally as well. But why are we causing the inflammation? What's causing the inflammation? That's what we have to look at. And what we're finding, like I said, this truck driver, after he was 45, and it happened to coincide to about 1998 to 2002. This isn't a conspiracy theory, guys. We did this with this patient. That's what we came up with. The genetically modified things that are in our diet that your body's not used to. You guys all remember that commercial? You can't fool Mother Nature, you know, and then she has like a hurricane or something when everybody tried to fool her. You can't fool your body. You really can't. But what your body will do is quit working at its 100% efficiency. And so what do you have? And again, guys, it's a cascade of events, and we'll go through it again in a minute, and everybody will understand the treatment momentarily. But through the process, you have to understand that the inflammation, you're bringing that into your body. How? How are we getting that inflammation into your body? Chemicals are big. I'm trying to show, I have a picture of the head here. There it is. Right here. Do we pay attention to what we eat? Do we pay attention to what we put on our face? Why do I bring that up? Have a patient for almost 30 years now, and we both suffer from sinus disease. And since I've known her, she's always been one step ahead of me to treat allergic rhinitis, because we both have it. She first came to me with the neti pot. I don't know if you guys ever heard of a neti pot, where you hold one nostril and you pull, and it works. It clears out your sinuses. And then she came to me with other things to do. Her latest one, which blew me away because it works. And once again, what does this do? Stops inflammation. Every night, she takes Johnson's baby shampoo, takes a cotton ball, dips it in there, and washes her eyelashes, her eyelashes, as well as the eyelid. And she said to me, when was the last time I washed my eyelid? And I said, I don't think I have. And she said, well, I'm not going to you anymore because you're a dirty doctor. And I laughed, but I thought about it. I have never, ever washed my eyebrows and my eyelashes. I mean, I've washed my face before I go to bed, but I've never done that. I have less sinus problems since I started. And she threw it back at me. It causes inflammation. What you get on your, because when we open our eyes, the eyelids are up. So again, if you don't, and you have to scrub them, that was, she said, don't just dab them. You have to actually wash it, as if, and that's why you use the cotton ball. So please try it for those of us that suffer. And what's interesting is everything does get absorbed on the inner part of your eye. So it does make sense that if you're not literally washing them and you're just throwing water on them, some of that is what causes, and that's usually where we get it. You know, with the allergies, it's right behind your nose. And it definitely has cleared me up since I tried it. But the reason I bring that up is that's a subtle place to pick up inflammation. You can get, I pick my fingernails, I don't really bite them, but like next thing you know, as a nervous habit, I'm just picking at them. Inflammation. Rubbing your eyes. Inflammation. So again, pay attention to the things that cause inflammation. Pay attention to your face, because a lot of times that's where they say it can occur the most, because we all pay attention to our face. Men pay attention to shaving. Can't see it today, but I cut myself shaving at my daughter's on the Saturday that she got married. And they're like, Dad, you cut yourself shaving? Because I had like a piece of paper there, like toilet paper. And I had it when I walked into church. And the only person that didn't mind was my daughter that was getting married, so it didn't matter. But everybody gave me grief over it. But my point is there's ways that inflammation occurs that we don't pay attention. Ladies, when you shave, that's inflammation. Okay? Again, the body wasn't made for a razor to go over and take all that hair away. That's not what it was meant for. So all these things contribute to the inflammation in the body that occurs every single day. So does that mean we all quit shaving, we all quit? No, just pay attention to that's an inflammatory process. What's the good news? Things like blueberries, which are the #1 antioxidant in the body, will help all that, okay? And I'm not promoting anything today. I'm just giving you the information, okay? So now, if we can do something about the inflammation and we can get the iron back into the brain and the vitamin D back into the brain, do we see a benefit? My truck driver is good, and there's a lot of different data. Most of it is coming out of Princeton University. So if you guys want to Google, Google the Princeton University studies on dopamine and iron deficiency, and you'll see the information that's out there. But once again, guys, what we found was the receptors in the substantia nigra are not 100% efficient, and it's not proven. That's why it's still a syndrome, but all the research is trying to show what is causing these receptors to be less than perfect, and what is the most important factor? Inflammation. What's the body's biggest obstacle in terms of what we're putting into our mouth? Genetically modified foods. What does that mean? That means that what they've done is they've manipulated the gene in order to get a response with whatever the chemical or whatever the product happens to be. I know wheat. I was shocked. I'm sure we talked about it last year. Has anybody ever heard of Roundup? It's the spray that kills everything. Our wheat in America has been genetically modified. Roundup won't kill it. So what does that mean? What it means is the gene has been manipulated. What does that mean? Well, that means that how our body's going to react to it. Imagine, it's now capable of withstanding a pesticide, essentially a chemical that could and should kill it because it kills everything else. But it can resist that. So the manipulation of the gene to protect the wheat has had a genetic effect. And as we metabolize it, we're having problems with it. Okay, so when I say problems, is it everybody? No. What's the analogy would be somebody that has a problem with certain foods so that they have to change their diets. Once you figure out what your diet is going to be, you're fine. But again, do you know that you're getting something genetically modified? So we know that the data showed fructose corn syrup, 1983. Since 1983, fructose corn syrup is a sugar substitute in so many products. I was amazed. I think it was the 2018 Super Bowl, if you guys remember the commercial, where the beer truck was pulling up. It showed like cavemen kind of guy. And they asked if this was your fructose corn syrup. And the beer commercial was able to say, no, we don't have fructose corn syrup in our beer. And that's when it hit me that if somebody that big is actually bringing it up, it's something to pay attention to. And it has to be on the ingredients on anything you eat or drink. It's there. Please look up fructose corn syrup and look for GMO. If you see any of those two things, avoid them. Because again, what it does, inflammation. And the inflammation is the biggest problem, okay? So what we end up with now is the goal is to get the iron across the blood-brain barrier. We'll put that BBB. get the vitamin D3 across that barrier, and ultimately hope that this dopamine resistance changes. I can tell you the animal studies, it worked. Are there human studies? No. Are there humans actually doing it now? Yes. And that's why I said that the data's out of Princeton that you'll be able to follow. That's what I'm going to follow. And I'll update everybody. I'm sure next year we'll talk about it again. But for me, what it showed was the effects of what we're eating and drinking are real, and you have to pay attention to it. And then for the person that suffers from it, it's so amazingly difficult to explain, because what it does is it affects your sleep. For those of us that have ever gone sleep deprived, I just did for the weekend with this wedding. It was crazy. And all my kids were around, so I didn't get my normal amount of sleep. So I was cranky Sunday. But the point comes back to this is every night. Every night you're going through this. You're not getting sleep, so you're sleep deprived. What does that do? It changes your mood. What do we know about dopamine? Dopamine affects your mood. So what happens? All of a sudden, all the chemistry within your brain, those neurotransmitters that enable you to do what you do, be who you are, get changed. And what that change leads to, different for everybody, but very similar in terms of mood changes, mood swings. So that person that was always a motivated individual that set their goals, achieved their goals, and enjoyed the reward of that, gone. All the functions of the dopamine are compromised. And it changes everything. And then what generally happens is you get to your doctor, and what are you going to be? Depressed. What happens? You get put on serotonin. What is serotonin? A neurotransmitter. What effect does it have? Maybe nothing if it's just a depression. But if you also have trouble with the dopamine, now it's chemistry within your brain. And once again, side effects, all these medicines have side effects. So please pay attention to that. What I want to make sure now everybody understands, let me go through this, is, oh, perfect. We can even do it on there if there's not enough paper. Perfect. How do we treat? First and foremost, lessen your inflammation. Two things I'll have you do. Number one, I already told you. Pay attention to your eyelids. And please give me some feedback, guys. I'm amazed at how different people feel washing their eyelids now. It's incredible. Two, pay attention with a lot of stars to what you eat. Is hot sauce inflammatory or non-inflammatory? Anybody venture to put a guess in there? Non-inflammatory, because it stimulates the hydrochloric acid in your stomach, and it's all okay. Okay, but my point and why I bring it up is if you don't pay attention to what you're putting, and we'll put them up there again, because it's your lips. It's what goes through the lips. You have to pay attention to everything. And no smoking. You can't do any of the smoking. But for the treatment of the inflammation, the main thing you want to pay attention to is what you're eating, and then I'll put drink in there as well. And then I'd look at bodily function. So number two, mouth, tooth care. It was another thing that amazed me. Two patients I had, and then personally, I had a situation. I was eating a hard pretzel and I cracked a tooth. And before I went to the dentist, because I hate dentists, I probably was like 6 weeks, and I noticed I was feeling different. As soon as they fixed it, it was amazing how different it was. So what we're finding is things like the eyelid and mouth care are high on the inflammation list. And again, guys, above the neck. That's why we're talking about it. So people that mess around with their ears, make sure you understand. You put a Q-tip. I have a lot of patients who say, I'll look in the ear and say, why is it so red? Oh, I just dried it out with the Q-tip. Well, no, if it's red, it's inflamed. So these are the kind of things, rubbing your eye. I do that. You know, if you have one of those days, I put my cheaters on to see something, I finish seeing what I'm seeing, and I rub my eye. It's not what you're supposed to do. You know, things that we do habitually, pay attention, because if they're causing inflammation, it's a factor that can lead to problems. Does that mean you're going to get restless leg syndrome unless you do this? Of course not. But if you have it, pay attention to these things because they're important to see. All right. Now, foods to be aware of. Hot spice does not cause trouble, but certain other spices do. And the reason I bring this up is it depends on your culture, which you've grown up with. Sometimes it's hard to stop. For me, I love spaghetti sauce, but I find certain sauces cause inflammation. Now, do you eat enough blueberries to offset that? Because that can be done, especially if you talk to the vegetarians out there that know all their things that they're taking in. There's many foods you can eat that are anti-inflammatory. The one they pick is a root that's called turmeric, is the one you'll buy on the shelves. The best anti-inflammatory that's out there. So again, do you eat what you want and just take some of these anti-inflammatories, or pay attention to what you are eating? And I recommend maybe both, but definitely pay attention to what you're putting in, and please write it down. I have found that no matter what you believe you can remember, you can't. So if you really want to do a dietary evaluation and determine what you may or may not be taking in that are inflammatory, write it down. And then you'll be able to go back to it to see, okay, this is my go-to breakfast, this is my go-to lunch, this is my go-to dinner. And what you'll find out is there's a lot of inflammatory components to what you're eating, and you may have to modify it in order to get rid of that inflammation. What's the other thing we find? Joint pain. What is that? Inflammation. If you have joint pain and you're not treating it at all, the inflammation that you're causing circulates through the blood system. Does it reach the blood-brain barrier? What they say is that we can't take that kind of pain, that the amount of pain you would have to be getting every day in order to have that impact on the dopamine would be so substantial that they don't think it would hit that. But I know I've met a lot of people that what they put up with, quote unquote, with their pain is amazing. And so I believe, depending upon what we're talking about, rotator cuff on somebody that used to make ravioli, and now she doesn't make ravioli anymore because she can't do that dough, that's fine. That's a different story. But if you have bad knees or bad hips or a bad back, and every day you're doing your household routine and things along those lines, that's significant inflammation. How do we deal with it? The blueberries still are wonderful. Cherries still are wonderful. These types of things have been proven. The turmeric that we talk about, these are strong anti-inflammatories, and they work, and they're cheap. So pay attention to these things, because by limiting the inflammation has the best impact on the receptors becoming more functional. The other thing is we get the iron and we get the vitamin D3 very simply now, and all the products on the shelf will tell you that it crosses the blood-brain barrier. This is now information that's out there everywhere. So you make sure any of the supplements that you would take, whether it's iron or the vitamin D3, you make sure that it says that it'll cross. Ask the person that you're buying it from. If you go to GNC or one of those stores, they will tell you. To not have to supplement, you still can't beat liver. Who in here eats liver? My grandmother used to make me, and I love it. Okay, but again, that's still the best for iron. Leafy green vegetables, you know, your spinach, excellent for iron. So I'm not telling anybody to go out and buy stuff they don't have to buy. Just watch what you're eating, and then get the blueberries, get the green leafy vegetables, eat the liver, Make sure you're out in the sun, put as much time in the sun as you can, but make certain of paying attention to what you're consuming. Now, do I recommend that we take the treatments that are out there? The dopamine agonist, no. The opioids, no. The muscle relaxers, no. And why for these? Because they're not going to cure it. They're not going to change the receptors of dopamine in your brain. You're going to get used to all of them, and you're going to need more of all of them, and especially the opiates now. These are just bad news. So we definitely want to get rid of these for the treatment of restless leg syndrome, guys. I'm not talking if you need them for other things, that's a whole different story. But from the vantage point of the restless leg syndrome, what I find is that the patients that utilize these, they only get temporary relief, and then they find they're using more of the medicine in order to get that temporary relief, and then ultimately the side effects of the medicine end up causing more troubles than it's worth, and then we make a change to something else. Some of the medicines that increase the blood flow, there's a lot of medicines such as calcium channel blockers. Improving the blood flow is still best. How do you improve the blood flow? Exercise. And we talked about that. Standing up and sitting down is still the best exercise. You use all the muscles that you have in your thighs and your buttocks. So you're watching television, and again, jumping up and down doesn't help. It has to be slow. It has to be slow. So if you're watching a show, every commercial, just stand up and sit down, stand up and sit down. Moving your hands. I told you I did the Sit and Be Fit, that program, and I saw a 90-year-old make me sweat. She was doing it so fast, it was incredible. So as I did it that fast, I was sweating. So it definitely is exercise just by moving your hands and your arms. The key to exercise is more blood flows through the body, and the blood does get to the brain. So when you exercise, the good stuff in your body does get to the brain. That will help. So please, for increased blood flow, exercise. Walking and all that stuff is good only if you can do it. Water, still the best. Now, when I say walking, I don't recommend treadmills because what I find is that if we quit paying attention, you can have a serious problem on a treadmill. And all too often, I know when my kids come home and everybody gets on them and I do it with them, I'll be listening to what they're talking about, and I find myself stepping off to the side because I'm not paying attention to what I'm doing. So I don't recommend those, but walking in your own apartment is fine. It doesn't need to be a mile. It doesn't even need to be 100 steps. The whole idea is moving those muscles every day. That's still the best because what that does is the blood flow from your body helps with the inflammation. So the water increases the amount of blood, which has all the support that you need for the anti-inflammatory. So exercise and water, I still promote the most. In terms of actual medications that I've seen out there that are on the market that work, I don't promote any of them. But what you're looking for is iron, vitamin D3. That's the main ones you need that cross the blood-brain barrier. I'll put barrier. And any of the places that you're going to purchase them will show you that. And again, guys, please remember, I hope I made the point by showing you how 350 milliseconds is pretty quick. And it's 200 milliseconds if you wiggle your big toe. It's the largest nerve in your body. And for all that to happen, you need these chemicals to be top of their game. And what we find is it's what we eat. You have to pay attention to what you're eating. And you have to pay attention that if there's things that cause inflammation and you like it, that's fine. but please don't take a pill to fix it. I saw that at the wedding. It was funny. Like, what happened, my daughter scammed me, and we ended up from the game, I had to take 35 people out to lunch. And so I recommended that we go to a favorite Italian place that I go to called Pizza Roma, and I raved about the chicken wings and the pizza, and it worked. Everybody ordered chicken wings and pizza, so it wasn't too high of a bill was the bottom line. But I saw these guys eating Prilosec before they ate the hot chicken wings. And I told him, I said, you know, that's not helping, putting those pills in there. But of course, they didn't want to hear from the doctor, especially after the Steeler game. You know, so again, guys, what I find to be so vitally important, remember my truck driver, you know, we'll call him Fred. Fred still has his run, and he works for a friend of mine, and they do this California run 3 times a week. And he's been doing it now, I know it's over 30 years. And this enables him now to finish this job out. And he got better by watching what he's eating. I think he dropped like 16 pounds. You know, he's paying attention to all labels of anything that he's drinking. And I have to throw out with the alcohol, guys, in his case, he was drinking too much. What's too much? What's enough? We talked about how many you're allowed to have, quote unquote, according to the statistics. What you find, though, is if you're doing more than normal, you end up with inflammatory processes occur. Gastritis is one of them. Most of us don't eat enough when we're drinking. And so what happens is if you get gastritis, that's inflammation of the stomach. That's inflammation that circulates through your system. So pay attention to what you're consuming. And I always tell people, Dr. Potter taught me, as long as your patients aren't drinking more than you do, everything's fine. All right, guys, please, what I want to make sure everybody realizes that if you're getting anything over the counter, and I would recommend over the counter, and watching what you eat. And remember, that's ingredients. Read the ingredient. And if you haven't done that, believe me when I tell you, that's the best habit you can develop. I can remember, I never did. And Dr. O'Neill, Betsy O'Neill, was a good friend of mine. Long story short, she taught me about water back in the 90s. And she would tell me way back, because that's part of what the FDA regulates. They have to have every ingredient that's in whatever you're about to consume has to be written. And it goes from most to least. So whatever's number one, that's the most ingredient in that product. So if you see GMO anything, or if you see fructose corn syrup, please stay away from it. Those two are proven. They cause nothing but trouble. And again, these are things that you want to do by watching what you're taking in and trying to avoid these inflammatory products. That's how you get your sleep back. That's how you get your legs back. That's how this is the best treatment that you can do. Taking the pills, if you need them now, that's another story. If you go to your doctor and it's working out for you and you're able to get your rest, because that's the biggest factor. The restless leg keeps you awake. And any sleep deprivation is not good. In time, it'll cause troubles. So please, please pay attention. I believe that if you're watching what you're eating and you're paying attention to the ingredients and you still feel that you have symptoms, I would definitely go. I actually do promote a place. It's called Pharmacy. It's out North Park. You go through the park, you pass up the cannon. It's still Ingomar Road, and that'll eventually take you to Route 8. You go over train tracks before you get to Route 8, right on the corner after the train tracks by the light. It's called Pharmacy. It's spelled F-A-R-M. And he's a good friend of mine. His name's Dan, and he does all natural. Everything is natural. So if indeed you're having a problem with restless leg syndrome, that's the person I would get out to see, Dan, and he'll make sure that what you get has the iron and the vitamin D3 in it. And it's not an arm and a leg. It's not like it's going to cost you a fortune. These are ways in which you can get natural things to help get those receptors back, because so far that's what all the data points to. It's the dopamine, in the brain related to the receptors being ineffective, and most of it's coming from whether it's an allergy, whatever the process is that triggers that inflammation keeps that dopamine from being produced. And that's how you end up, and that's why they found it at rest as well. So please pay attention to it. Sorry I was late, guys. I'll blame that on, who I blame it on? Joanne. I talked to Joanne. She was at the wedding. Joanne Betts, my nurse practitioner. I call her the stay-at-home mom. She gets mad at me when I call her that. But she is considering, again, she now goes away for the winter. So she said in the spring she'll think about it. But the fact she kept her license up, she kept all the stuff up that she needs to still practice, I think we're going to get her back. Any questions, guys? Yes?
I always heard the restless leg syndrome happened when you were asleep, not when you were awake.
I would say probably, no, not even 50-50. It's definitely more when you're awake, not when you're sleeping. But yes, it can happen. I've had patients tell me that they get to sleep and then they wake up kind of like feeling a cramp, and then it hits them and they can't stop. But that's the minority. Most of my patients say, like, they'll be tired as ever, go lay down in bed, and right when they think they're going to get that sleep, that's when they get the problem and they can't shake it. Yes?
Is restless leg syndrome hereditary?
Can be, but we haven't proved the gene yet. What we find is, yes, if you go through the families, mom had it, sister had it, brother had it. So from that vantage point, but we haven't found anything genetic yet. But I do believe from what the literature shows, they're close. And once they connect all the dots, like we talked about with diabetes, for the longest time, we didn't know anything about it. Or even pick Parkinson's disease. Parkinson's was a syndrome way back. But once they found the dopamine crossed the blood-brain barrier and they treated it, they closed the link. So if they do find something to get those receptors back, then I think they'll close the link. Then they'll be able to do genetic studies. But they won't do it when it's a syndrome. It's kind of like fibromyalgia, the same thing. Is that hereditary? Genetically, we can't prove it, but yes, it's in families. And yes, you'll see it in each generation of family members. Other questions? Yes?
When I get restless legs, I get up and I do the exercises that would do in the life,
Okay.
and I get rid of it.
For the rest of the night? Excellent. Good. So we didn't rehearse this. So see, the exercise does help. She says that when she gets it at night, she does some exercise, and that gets her through the night. Again, guys, it's definitely, from what I see, there's no doubt inflammation is the main problem. It's the biggest culprit in this situation. So please pay attention to what you're eating. Yes?
John's had his restless legs ever since he was 14 years old. All these years, he's sleeping less and less and less because he can't get enough rest. He lays down in bed and he's there for half an hour to an hour or something. He's back up again because he cannot sleep because it keeps him awake, and it's just crazy.
And they move on you too?
I might add this, that over that period of time, the thing I found that helped the most was a teaspoon of baking soda in a glass of water.
Isn't that interesting? So that's the pH.
Gas in the stomach has something.
It's interesting. Make sure you guys do this because the same thing with inflammation. Men and women have different effects on different substances. And I didn't believe it till I did it. And have like a nephew or a cousin or someone young do this because I don't want anybody falling. If you would take a chair and the man leans against the wall, he can pick the chair up. If he stands up and takes a teaspoon of sugar in his mouth, just keep it in your mouth, you cannot pick the chair up. A woman can. And it's again how we absorb things, but the sugar, because it's not natural, causes inflammation that fast. Try it. It's remarkable. And once again, that's the dopamine receptor that enables you to lift it up.